Hello, I'm Dr. David Anderson with the Veterinary Medical Center for Horses and Farm Animals here at the University of Tennessee. Today we're talking a little bit about gastric ulcer disease in horses. And I'm visiting today with Dr. Karen McCormick. Dr. McCormick is board certified with the American College of Veterinary Internal Medicine, which means she's a specialist in diseases of the horse. And so, Dr. McCormick, we hear a lot about gastric ulcers in people. Is that a problem in horses? Is it common?
It's a very common problem in horses. Probably more than half of horses, if we looked, we would find ulcers. But especially in performance horses and foals actually have even higher incidence of gastric ulcers.
And so if ulcers are fairly common, you know, I don't know that I've ever seen that in my horses. What type of thing would I see that I would recognize that would make me call a veterinarian to find out if my horse has ulcers?
Well, sometimes it can be more obvious than others. So sometimes they might go off their feed, especially their grain, because that produces more acid in the stomach and makes them feel a little bit more uncomfortable. But it can be as subtle as just a poor performance and just being a little bit off when you're riding.
Okay, so if something's amiss, I should call my veterinarian to try to find out what's going on. If my veterinarian was worried about my horse having an ulcer, how would we know? What would we do to try to figure out if that's truly what's going on?
The best option to try and figure it out is actually to do an endoscopy or gastroscopy, where we put this 3-meter endoscope down through the horse's nose and down into the stomach. And that's done under sedation, but the horse is standing, and they actually take the procedure fairly well. And then we can take a look in the stomach and actually see if there are ulcers there.
Is this procedure dangerous to the horse?
It's very, very safe to do. It's just a matter of sedation, which we do very routinely in horses for lots of different procedures.
Okay. And so now I'm worried a little bit. You know, that sounds serious. Are gastric ulcers, can they kill my horse? Are they a life-threatening problem?
Yes, if left untreated, if they got very severe, it could cause perforation in the stomach. So it's important to get on top of it as soon as we notice anything going wrong with the horse. And we treat those with a drug called omeprazole. It's similar to what a human would take, but it's formulated special for horses so that they can absorb it properly.
So is the horse stomach shaped the same way as the human stomach? Is the anatomy identical to people, or is there a little different there?
It's actually quite different. The lining of the esophagus comes down into the horse's stomach, basically. So that part that's very susceptible to having ulcers on it extends into the horse's stomach, unlike us, where it kind of stops at the top of the stomach. So that's very susceptible to ulcers. And when the acid splashes up onto that lining, then they're more at risk of getting the ulcer.
Okay, so it's sort of like esophageal reflux disease in people.
Right.
It's refluxing where the acid shouldn't be.
Right.
Okay, and so the drug therapy would neutralize the acids to a certain degree and allow the horse to heal. How long would it take? Is that something that's hours or days or weeks? What course of therapy would I expect?
The typical course of treatment is about a month long of the omeprazole, but we also make management changes too. So things like having our horse have constant access to hay to buffer that acid in the stomach and keep their stomach full. Horses are meant to eat all the time, right? In the wild, they continually eat. So the way we feed our horses actually predisposes them to ulcers. So it's important to keep food in front of them all the time, decrease the amount of concentrate in their diet because that produces more acid. It's also important to reduce the stress in the horse's life, so providing a rest period so you're not showing and not really using the horse for a short period of time while the ulcers are healing.
So you've mentioned stress as something that's part of the ulcer complex in horses. What is stress? It's such an ill-defined term. We talk about that a lot, but what do we really mean by stress?
So different things in a horse's life might make them stressed, and apparently it's just stressful to be a horse because it can be anything. But some things we think about are going to shows, going to events, potentially changing fields or just changing the horse's environment, taking away a friend, adding a new friend to its field. All those things can cause stress and result in ulcers in your horse.
Okay, so I've recognized that my horse has an ulcer. My veterinarian or a center that my veterinarian sends my horse to would be able to do the endoscopy and confirm whether they have an ulcer or not. We've done the drug therapy to treat the ulcer. Is it likely that the horse is going to recover? And if it does heal from the ulcer, am I ever going to be able to return to a normal performance with the horse?
It's definitely possible to go back and do what you were doing, but there may be some preventative measures you'll need to take. We can keep it on a lower dose of that medication during those stressful periods. If you're going to a show or to an event, a lower dose of the medication can help to prevent the ulcers as well. That's
incredible. You know, here at the University of Tennessee, we're dedicated to premium healthcare. We want to help you and your veterinarian get your horse back in the field and keep them healthy. If there's anything we can do to facilitate that, don't hesitate to contact us. Talk to your veterinarian about what's going on at the University of Tennessee. We're excited to be a part of this amazing enterprise and to try to improve the healthcare of horses.